Hi, welcome to the second episode of You Matter, the podcast we started. I am Chubhai Roy. I am here going to represent the mental illness team of Niramai Soul, and I am glad to invite Shatavisa Majumder, our senior clinical psychologist, again to address these issues because these are some of the things that really has become a reason for concern. So, over to you, Shatavisa.
Thank you for having me again.
So, the topic of today's podcast is depression and suicides and self harm. Now, the reason for picking up this topic is predominantly to address certain numbers which we felt really disturbing as a team. We see people around us who are laughing, smiling, giving their best to show everything normal. But they are the one who look from strongest from the outside are the one they are probably struggling with themselves. Depression is not something that usually gives you that pain of exhaustiveness one day. You have to wake up with the same feeling on daily basis. The numbers as per World Health Organization says that around 280 million people across the world are suffering from depression. Imagine so many people getting up every day with the pain, with the helplessness in mind. Further, when you hear the numbers which caters to the suicide is again very bad. It's more than 7 lakh people around the world who are facing suicide, which is almost one in every minute one life is lost. When you look at India, as per data available, alone in 23 itself, 1.7 lakh people died by suicide, which means that there is a gap. There is a gap in terms of understanding and how we look at mental wellness. And with this podcast, we will attempt to make myth past the myth and try to focus on the facts so that people who are listening, or if you have anyone around you who are suffering, tell them that they are not alone. They are not going to be unheard. They just have to look up and ask for an help. And that help they are going to ask is going to be the one big step they are going to take to make sure the rest of the life is better. So, Shatavisa, the first question that I want to ask you is people often confuse depression with sadness. What is the difference between depression and normal sadness?
Okay, so sadness is a natural human emotion which all of us feel, and it comes and goes usually in response to something. But depression, on the other hand, is more persistent and it can impact the way a person thinks, feels, and functions. So it is not just sadness, it can impact your sleep, your appetite, your energy level, motivation, your ability to experience pleasure and relate to the outside world.
But from a very normal human being perspective, I see sadness, like you mentioned, there is a reason behind it for which I am sad. Even usually depression is also because of certain event that might have happened, certain incident that the person might have gone through. So again, the difference is very thin. And what do you think about that?
So sadness is temporary, but as we discussed previously, that depression can last longer, even for days, weeks, or months. Also, another difference which I can say is that sadness happens in response to some events, like say loss, disappointment, something has happened. But depression can happen without a clear trigger or reason. And thirdly, what I want to mention is that, even with sadness, we can continue our daily lives activities. But depression, especially in severe form, it impacts our social functioning, our occupational functioning, day-to-day functioning.
Got it. Now, before starting with this Niramai Soul, we were part of consulting. And in consulting, when you work for Big Fours and everyone, it is always the nature of work is such that you are expected to do 12 hours. Now that brings me to the fact that people usually they don't understand am I really depressed? Or is it that stress and burnout? So how does people can differentiate between the stress, burnout, and whether they're actually depressed?
Okay, so when we talk about stress and burnout and exhaustion, yes, exhaustion can actually look like depression, and that's why people often get confused. But you know, as with exhaustion, there are certain symptoms like you are very tired, you are chronically fatigued. Similarly, in depression also there are some symptoms which at times we ignore, like even after taking adequate rest you may not feel fresh enough, so you may feel chronically tired, and also difficulty in concentration. And depression doesn't always come as sadness or crying, right? It can appear as irritation, it can appear as anger, right? And nothing, no emotion at all, feeling numb. So these symptoms often people ignore.
Sometimes I have seen that, especially working for 5 days a week, on the 6th day, if you are, if you're asked by your family to go out and all, you don't feel like getting ready. You don't feel like getting out of. So what do you classify that? Is that sounds a bell in the mind that I'm depressed, or does that mean that I'm still very burned out and I take more rest?
Again, it depends on the functionality of the person in general, how they are able to perform their daily life's activities and role functions. Also, the duration criteria, that how long they have been feeling like this, how much intensely they have been feeling like this. Because at times we may feel like not wanting to hang out with people or socialize a lot. Maybe we are tired, maybe we're not physically well, or we don't just feel like doing it. But just because we're not feeling like socializing, that doesn't make me depressed. It may be more than that. So we need to, probe into it.
So this brings me to the next question actually. That sometimes, like I say, without a reason, you just don't feel good. You just feel that something is not right. Now, can depression really happen without any reason?
Yes, absolutely. You do not need a visible trigger all the time to have clinical depression. And depression can happen due to many reasons, not just any specific life events. It can happen due to some genetic factors, some changes in the neurochemical inside the brain, some unprocessed emotional experience, as well as life stressors. So there are many factors which can contribute to depression, and just because there is no specific trigger you can put your finger on, that doesn't make your depression any less valid.
And typically now we say that gone are the days when people after 40-45 used to fall sick with issues related to chronic diseases, right? Now we say that even after 30s people do. Is there a specific age segment that we see this happening more, or it can be across the different?
Yes, depression can happen to anyone. Actually, even children also have depression. Though the way adult people, their symptoms of depression are manifested, it's not always the same for children, because children cannot verbalize like adults. Like I am feeling depressed. Yes, so they cannot express just as an adult does. But their depression can also it can appear as irritation, difficulty in concentrating in schoolwork, and maybe having frequent fight with peers, and not listening to parents. Not playing, staying indoors, not
sleeping for more time.
Not being excited about anything.
I've seen that. I
can happen. And also in adult, like older population also, it's very common that we see depression happening in older, like elderly people.
So what you mean to say is that one doesn't have to have a negative event to trigger this depression. It can happen for very different reasons.
Yes, absolutely. Yes, negative life events can contribute to depression, but depression can also occur in absence of any specific negative event. It can happen in seemingly stable life stage of life, or even positive stages of life also, when good things are happening.
I have seen, an unfortunate event where I have seen one of my ex-colleague who was looking very happy from outside. He was married, having nice kids and everything. So often people, while they look very happy from outside, they are, you know, in with you acting absolute normal in a social setup, but from within they are fighting. So why does people, even if they feel depressed, still feel happy from outside? How do they do that?
No, more than actually feeling happy from outside, we can call it masking, because when people have been struggling with something for a very long time and they have to perform certain roles and responsibilities, they kind of.
You don't want to show the negative side of it to show that they are weak. It also presumed to be a weak thing, right?
They can learn their own ways of dealing with situations. So there is a thing called smiling depression, where people may appear very happy from outside, but they are actually not happy from within. They are probably struggling silently.
So, can high functioning successful people be depressed?
Yes, absolutely, because success doesn't protect anyone from having mental health struggles. What happens with high functioning successful people is that they are usually able to often they are able to push through their symptoms, so it's not even noticeable that much. So everyone around them tend to ignore their distress. They themselves also tend to ignore their own distress.
Is it more of they mix up stress, burnout with depression, and at the end of the day things are out of hand?
Yes, that could be one reason, and also it may come from the common belief that I can actually help myself. I don't need any external help. So people often think that if I am functional, if I'm going to office every day and doing very responsible job outside, then I'll be able to actually handle myself. So that also contributes. Yes, that's a misconception. Yeah,
I have seen people with depression withdraw from the people they love. What do you think about that?
Yes, it happens that they tend to withdraw from loved ones. They tend to interact less, but it is not because that they don't love the family members or friends anymore. It's not due to lack of love. It is probably due to lack of emotional energy, capacity. Often they feel like not interacting much, because socialization actually takes a lot of emotional energy, so they don't feel that emotional capacity or that energy in them.
So when you're saying about the emotional capacity, how about the physical one? Can depression also show up physically?
Yes, absolutely, because depression can impact your physical body. Physical health, mental health are very much connected to each other. So it can impact your sleep, it can impact your, it can cause some body pain and difficulty in sleeping. Digestive issues can happen due to depression.
Can I say like this, that if people are usually introvert of nature and they start feeling irritating or not feeling like talking a lot, that can be a symptom for depression?
No, we cannot, absolutely with all certainty we cannot say that, because being introverted or extroverted, that is how people are, like their personality. So yes, there are some symptoms when a person is clinically depressed. They may feel they may seem very introverted in a way, because they don't talk much, they don't interact much, they socialize less. But we cannot just tell this that
it can happen to both.
An introverted person can have depression also. An extroverted person, or any type of personality, whatever personality type people have, anyone can develop depression.
So what do you think, how mental health is connected with physical health?
Yes, as I said that depression or any other mental health conditions can lead to a lot of difficulties in your physical body. In the same manner, if somebody is physically ill, say somebody has a chronic illness or has some injury, so it can also impact that person's mental health. So physical health, mental health actually impact each other. It's a two-way traffic.
So often I heard people giving them advices which are usually typical advices that we see from our friends and family, that just be positive, things are even worse with others. Why don't these statements actually help the people who is suffering from depression?
Yes, yes, these are very common statements which we all hear around us. But these statements usually don't help, and they actually oversimplify depression. Depression is not a motivational problem that you will listen to a motivational podcast or watch a video or read a self-help book and automatically you will get better. You will come out of clinical depression. It doesn't work in that way. And saying these kind of statements actually can make people feel even more misunderstood, guilty that I shouldn't be having these problems, and they may feel even more isolated. Like they may not even come out and ask ask for help. So this is like toxic positivity, that please be positive when there is nothing the person can find to feel positive about. Doesn't help.
But when you look at it from other way around, the family members, when they see you not being your best, just sitting in isolation or not sitting with people, just locking yourself up in the room, you have to say something, right? Being a parent, you cannot just see them going through the suffering.
Correct.
The parents are the one who understand the pain of the people, even if the age doesn't matter. For them, for the family, we are still the young ones, right? So what then the family members should do in such case other than motivating? What should the message for those people, the family members actually?
Yes, very important question you have asked. So yes, it is very difficult for any family to see their loved one suffering in silence. So they try to help that person in whatever way they feel would be helpful. So they have good intention, definitely. But before answering your question that what to do, I would answer the question. I would like to say what not to do, basically what to avoid. So one thing is the toxic positivity, that forcefully trying to make them focus on, see, this is a good thing happening in your life, this is the thing you should be grateful about. This doesn't help, so not doing that. Also giving unsolicited advices. People may feel overwhelmed. They may not take it well at that point of time, right? And also invalidating their concern. Though no, it's nothing, you're just overthinking, or you just go out and do more socialization, do yoga, you will get better. So these usually don't help. So minimizing their problem and comparing their struggle with other people, that look at this Mr. X, like random people, that see this person is doing so much better with mental health struggle, or look at the people who are suffering even more than you. These comparisons don't help at all, right? And what to do instead? Yes, what you can do is listen to the person who is suffering. Very important. Be patient. Offer your presence with them gently. You can encourage them to seek professional help, because depression is a clinical condition which needs proper medical intervention, medical attention. So encouraging them to seek professional help, right? And also, if your loved one is reaching out to you, sharing something with you, then please validate their feelings rather than dismissing it or minimizing it. Just listen to them and validate their emotions. That's very important.
Got it. I think you mentioned a very valid point of validating the problem. It gives them that assurance that someone is there to listen to me. Even if they're not to help, it will be more of getting along with the person and saying that, hey, you know what, we are here to help you.
Correct.
Don't worry, it will be okay. Now, this brings me to the question where I feel, can depression really be treated?
Yes, depression is treatable. Some people, they recover fully, and then there are others who can learn to manage their symptoms effectively. So the goal in treatment is not to just remove the symptoms. It is also to improve the person's functionality, their quality of life.
So then, how one should approach it? Do they approach it with therapy or medication or both?
It depends on the condition which the person is having, the severity, the intensity, their distress. At times, only therapy can help, because therapy focuses on developing coping strategies, making the person learn how to process their emotions. Medications work in a different way. Medications help to regulate the neurochemical imbalance inside the brain. So in most of the cases, what we see is that it is a combination of both therapy and medicines which give you a good outcome.
I have often seen that once people start feeling better, they don't continue with the treatment, be it medication or therapy, and suddenly the symptoms come back. Does that mean that the treatment didn't work?
Yes, it happens, and depression can be recurrent, but recurrence doesn't mean that the treatment has failed or it did not work. Like many physical illnesses, depression also can come back again. But there comes the role of therapy, very important, because therapy helps the person to understand the early warning signs so that they can manage even the slightest changes even before the full blown depressive episodes have come. So it helps in preventing relapse also.
Once a person is having depression, how much time does it take usually for him to recover?
It varies because some people may take weeks or months, but for some it may be longer duration. And healing is never linear, so the pace with which people recover also varies.
So far we have spoken about depression, how it looks like, what are the treatment. Now we'll go to another very important topic, which is also very sensitive, which is suicide and self-harm. Is suicidal thinking or self-harm always about wanting to die, or is it something deeper than that?
Not always, because yes, sometimes it is about wanting to die, and then sometimes it is about just finding some way out from the emotional pain they are going through. Self-harm, especially non-suicidal self-injury, can serve different purposes. To regulate intense emotion, or to temporarily feel emotionally numb, or to express things which are difficult to put into words, or it's like feeling like having a sense of control over their life. Another important thing here I need to mention is that self-harm is not just limited to depression. So self-harm can be seen in many other various psychological conditions also. Some personality-related patterns like borderline personality pattern. It can happen in trauma-related disorders also. So whatever the reason is, self-harm is something which is always, it tells us that the person is in distress, and it signals that they need some help, some support.
So what are some early signs people around us might miss?
Yes, there can be some signs which are very subtle and can be easily overlooked. Say, for example, being withdrawn, changes in sleep pattern like oversleeping or sleeping less, changes in appetite, eating more or not eating properly, and sudden mood changes, right? And talking about feeling like a burden on others, giving away their belongings. These are some signs. Another important point which we often don't understand properly is that when people are in very severe depressive episodes, it is very less likely that they would have that cognitive or emotional energy to actually act on the suicidal thoughts. So when people start feeling a little better, and family members start feeling a lot relieved that yes, my loved one is now socializing, talking more, looking more happier from outside. So at that time, usually we see this happening, that people gain back that physical energy, cognitive energy, but they are not emotionally completely feeling okay yet. So the emotional issues have not resolved, but they have mental energy back, so they can actually try to act on the suicidal thoughts. So it's very important that when somebody is getting better, apparently, we should not assume that everything is fine just by focusing on their outward behavior. It is very important to keep checking in with that person, to provide encouragement and support, and encourage them to continue seeking help.
So just to clarify, does depression always mean someone is suicidal?
No. Not everyone with depression will have suicidal thoughts, but it is always a risk factor, and that's why early help, intervention, support is very important.
Okay. If people are struggling, why do you think they don't just ask for help? Why people always try to hide it, hide these kind of thoughts?
Yes, because of fear, the stigma we have in our society around mental health and mental illness in general, that being perceived as weak person, or being a burden on other people. And especially in depression, what happens is that hopelessness is a symptom of depression. So people may feel that there is no way, no need to talk to anyone because nothing is going to help me anymore. So these reasons are usually something which keep a person away from treatment.
So let's say that if someone who are close to us does open up, what should we say at that point of time?
Very simple, that I am really glad that you told me about it. Thank you for trusting me with this. I am here with you. I can see it is difficult. You don't have to go through this alone. We can figure out these things together. Very simple, supportive statements.
So we just now spoke about if people open to us, what we say now. What are some of the things or reaction that we should never give to them, which can make them feel even worse?
Yes, when actually loved ones reach out to us for help, or they just share their stuff with us, even very well intended responses can also be invalidating. It can come across as very invalidating. So there are certain things which we should not do. So one thing is dismissing their feelings, saying statements like, no, it's nothing, you are overthinking, it's not that serious, just look at the positive sides, be grateful for what you have. That is one thing. Secondly, reacting with panic or anger, like, oh my god, how can you say this to me after all the good things in your life, and now you are feeling like this, and why didn't you tell me before? So being angry, that is never helpful. Then another thing is making it about themselves, that how can you do this to me, like after all the things I have done for you, now how can you feel in this manner? And also at times giving unsolicited advices or giving lectures, like it's nothing, do yoga, watch this video, read this book, you should go out more often, you should talk to more people. So these things usually don't help.
But sometimes even reacting to them with panic or anger also makes it worse, right? What do you think?
Yes, definitely. As I mentioned, that getting very angry, that how can you think like this, how can you feel like this? So they are in any way feeling a lot of distressing emotions. On top of that, if they have to manage the loved ones' reactions also, their anger, their panic also, then it becomes even more burdensome for the person who is actually going through that depression.
When do you think someone should seek immediate help?
Okay, so if I'm answering this question for the family members or friends, that if somebody, your loved one, is suddenly talking a lot about wanting to die or not existing anymore, or they have confided in someone that that I have a plan to end my life, right? They are suddenly out of nowhere, they are talking about delegating responsibilities. If I am not here anymore, then what other people will do, who will do what, like who will take care of my pet, something like that. Also drastic behavioral changes. So if these signs are there, and also the early warning signs which I discussed before, if you see those signs, then it is very important that guiding that person, encouraging that person to seek immediate help. So if somebody is having active suicidal thoughts right now, they can reach out to the suicide helpline numbers, and it is very important that they immediately get back to treatment, be it medicine, be it therapy, and reaching out for help is extremely important.
So you are saying that one option for them is to reach out to the suicide helpline number. Other is to seek professional help so that they can get the right set of advice to take it forward.
Exactly, because being in therapy is very important. At times, the situations may be so severe that they might require psychiatric medicines immediately. And when, say, nothing is available right now in front of me, then they can always reach out to the 24/7 helpline, which is available in our country, to seek that immediate help from them. And from there, they can take it forward, with the further plans in treatment.
So, by the best possible means, they have to reach out for the professional help at the earliest possible. That's the message you're trying to
Exactly,
give.
exactly.
What is the biggest myth about suicide that we wish that people should understand?
Yeah, there are many myths around suicide, but one myth I can talk about here. So there is a myth that if you talk about suicide or dying, then that would put ideas into someone's head. But this is not true, because silence can kill people, but conversation can save life. So the more you talk, at least the person who is going through something, they may feel seen, they may feel heard. But if we choose silence, if we don't talk about it, then we may ignore a lot of signs which are just right there in front of our eyes.
First of all, Shatavisa, thank you for giving us your valuable time for discussing about this thing. I believe that many people who are listening to us today would be able to understand what are the myths, what are the stigma, and what they should not do, what they should be doing from the individual point of view as well as from their family's point of view. I just want everyone who is listening to the conversation, let them know that they are not alone. At Niramay Soul, we have created a space of comfort, safeness, and everything that you say is very much confidential. If you need a help, just seek for it. You don't have to wait. Don't think that seeking help is a sign of weakness. In fact, it is one of the best things that you can do for yourself and the loved one. Do reach out to us if you have any queries, if you feel any sort of distress situation. We are just a phone call away. We again thank you everyone for taking out time and listening to this podcast. Stay tuned. Do follow our channels to get updates on mental wellness issues related, and let us try to break the myths together and try to build a better place for people who need help.